Okay, so we're going to turn to Jen Croke next, and she's going to be talking about, I'm just going to read it off here so it's going to change. Implementation of an innovative learning tool for radiotherapy treatment plan evaluation. I just want to note, though, that there are 2 talks out of 12 that are Canadian in this section. And we're approximately 1/10 the size of you guys. That's actually 20% of this. So if you do that math very quickly, it's still taking over the world. So yeah.
So thanks to Dan for organizing this again this year, because it's fantastic, and I'm so glad to see so many faces today. So we're going to talk about a project we've done. It's kind of phase 2 from last year, and then hopefully we only have 3 minutes for discussion, but looking at ways to make it accessible for everyone. So this is done in collaboration with, some physics. Jenna Edelman is a PGY5 in Radom. Jeff Winter is a newly graduated physics resident. Tom Purdy, Andrea McNiven are physics colleagues. No conflicts. So as our last speaker nicely said, radiation treatment plan evaluation has been identified as a gap for our trainees with respect to learning and evaluating. Therefore, I'll just get straight to our objective, was to implement and evaluate an interactive treatment plan evaluation learning tool for our radiation oncology and medical physics residents. I discussed this last year and at Astro, but just briefly. In phase 1, we did conduct a needs assessment of current and former or recent grads within Radonc and physics to evaluate their current confidence in treatment plan evaluation. Results were quite similar to what was just shown, and we used that just kind of as a way of confirming what our hypothesis was, that there was a gap. Then we have an institutional database of all plans, and then all plans, you could search this database to find all plans that have been rejected or unacceptable. The vast majority were rejected just for minor things, like they forgot to put the DVH in the plan, or they had the wrong count point, so the vast majority had to get removed, and then we were with a list of actually treatment planning errors that were rejected. And all of these were reviewed, categorized according to what the error was, conformality, hotspot, OA errors, medical hardware not being taken into account, for example, for a pacemaker. All of these cases were reviewed by 2 Radoncs, 2 physicists, and came up with that database, and then we also came up with just a pile of accepted plans. Then one of our medical physics colleagues created these learning modules using a graphic user interface. And basically, the first thing that he created, was that you can choose cases that we've compiled according to level of difficulty, 1, 2, or 3, 3 being most difficult or most complex. You can choose a site, or you can just say, give me a random case. So you choose your case, and it will give you a little blurb about the patient history. And this number here is the actual treatment plan, which I'll show you in a moment. And then there's the opportunity to review the case, and you get questions about each case. So is there an error, yes or no? Because this is a set of cases that is not just errors, so we didn't want to just make sure residents also know what acceptable plans look like as well. So is there an error, yes or no? We asked them to classify it according to the groupings that we've made. Where is the error? What is the error description? How would you correct it? And what is your suggestion to improve this plan? And then if they're all forced functions, so you cannot submit unless they're all filled out. And then that's the modules. Then the other part was, where are these treatment plans going to be stored? Are they stored on Pinnacle? Are they stored online? We have what's called Evoke. It was made by one of our physicists, Tom Purdy, which is a web-based DICOM radiotherapy tool. So it allows you to navigate in 3D a plan. And just highlighting, it's really hard to show this in static images without actually doing a demo, but you're able to see the images, the DVH, the beam's eye view. You can turn on and off the contours. You can turn on and off dose lines. You can turn on and off beams. You can review everything. And all of these boxes on top take you to different things. So some will show you the dose distribution, the Dmax, the beam's eye view, the DVH, et cetera, et cetera. So you can scroll through everything. And then we demoed it. So we did it in our academic half days in the winter of 2019. We used 2 different sessions because some residents are on vacation, post-call, et cetera. We did it with our RADOC and our physics residents. The collaborators did an in-person review, and we also have done instructions of how to access cases, how to use the Evoke software that they can keep on our common drive. We did 3 cases that were different clinical sites, planning errors, and complexity. So for example, we did a whole brain plan where the lens dose was too high. We did a prostate case where there was it was not conformal, there was not treating the PTV adequately, and we did another case where a patient had a pacemaker and it wasn't taken into account that there was an AT. So just various things that we wanted to demo, and then we did a post-test evaluation of the tool design, how user-friendly it was, the case content, and the perceived impact on learning, and we asked for suggestions of improvement. And so to date, we have a total of 67 cases of varying clinical sites, levels of difficulty and planning errors that we've anonymized, transferred into Evoke, and have accompanying learning modules. 20 trainees in total attended the pilot, and of those, 90% completed the evaluation form. And just a snapshot of some of the results, and these questions we just made up ourselves, but 1 is strongly agree, 4 is strongly disagree, and they're all vastly close to 1, and basically I won't go through it all. It was very positively endorsed. The residents really were thirsty and hungry to get access to this. Even last year when we said we were making it, they kept saying, when is it going to be available, when can we use it? So they thought that the modules were easy to use, was helpful for learning. They thought the cases, although we just saw 3, were representative of things they would be exposed to, and they really enjoyed being able to interact and scroll and look at things in their own time, and they recommended it to others. So limitations to date that we're trying to overcome at single institutions. So there's going to be some bias with the way we do things at Princess Margaret, which is what the NCCN guidelines may say. So there's always that within the institution. Some cases could be outdated because the database, we use cases from 2013, 2014. So there's not so much of the, say, stereotactic, or it's more of the basics at first, but there is certainly curative plans, adjuvant plans in there, breast, GU, et cetera. The sustained impact on learning is to be determined. We're going to repeat our questionnaire again at around the 6-month mark, which will be on the fall. And the big thing is accessibility. Right now it can only be used in-house, which means that University of Toronto, Department of Radon is Princess Margaret and Sunnybrook, but it can't even be used at Sunnybrook yet. It can't be used at home, so we're really trying to look at that. And there's just been we had to pilot it to make sure it actually worked first when the physicist was making the learning modules. So in conclusion, residents were enthusiastic about the learning tool. Its interactivity was highlighted as a major strength. And currently what we're doing now is we're modifying the tool to make it a bit more user-friendly, a bit more attractive, because as you can see, it's just kind of gray and not that cool. But we have a student, an engineering student working on it, and we're expanding the number of cases kind of on a continual basis. We're going to do a more sustained impact on learning and distribution. So we're really looking at how to distribute this to make it more accessible everywhere, and we're trying to look at a web-based platform potentially for hosting it on maybe the Princess Margaret Cancer Education website. That then you can just get a username and log in and be able to house it. The thing is, Evoke was built in-house, so it's not something that can just be Googled and downloaded, but it is web treatment planning system agnostic, so it doesn't matter if it's clinical system, if it's on Centra, et cetera. And that's it, really. I want to thank all the collaborators and then all the residents who participated. This was an internal CE grant.